for employers, this is not a temporary disruption. This is, the operating environment. So,
Mm.
I mean, I guess, the punchline is that this complexity is probably here to stay. And the resilience really comes from designing for it rather than, hoping it goes away.
Business leaders know the future is already here. The economy is shifting. Non humans are entering the workforce. Nothing feels certain. SHRM understands those evolving challenges, both in the workplace and the wider world. In this podcast, we'll bring together authors, researchers, executives, and non traditional experts to help you take on the challenges others haven't yet considered. Because you don't need to be a futurist, you need actionable insights now. You need to be a Tomorrowist. I'm Jerry Wan. Welcome to Tomorrowist, where we explore the trends shaping the future of work. Benefits have long been seen as a supporting function, to something to manage, optimize, and keep competitive. But today, rising healthcare costs, regulatory fragmentation, and shifting workplace expectations are turning benefits into one of the most complex and consequential strategic decisions organizations face. Here to share her expertise on this key challenge is Tracy Watts, Senior Partner and U.S. Leader for Healthcare Policy at Mercer, where she advises large employers on navigating benefit strategy, cost management, and the evolving policy landscape. Tracy, welcome to Tomorrowist.
Thanks, Jerry. Thank you for having me.
We're excited to talk about this. Obviously, it's something that affects many of us, whether you are leading an organization or you're an employee. And so let's dig into it a little bit. It's sort of relevant today that SHRM named the escalating cost and design complexity of benefits as one of the top 5 workplace and policy issues for 2026. For our audience, the full report and additional SHRM research on benefit strategy are available in the show notes. But look at them after this awesome conversation with Tracy. And so we'll start off at the top, Tracy. How would you describe the current benefits landscape? Here we sit in the first quarter of 2026. And what are your strongest macro forces reshaping employer strategy right now?
So, when you ask about the macro forces, I would say there's several and they're not always easy to isolate. So, I think what I'd like to do is just comment on two of them in particular. And the one that I think is top of mind for employers is persistent healthcare cost pressure combined with affordability. And, when you think about it, we're looking at the highest trend for healthcare benefits in 15 years. It's right around 9%, and it's projected to be the same for next year. So, affordability is a huge issue for plan sponsors and for plan members alike. And that pressure is driven by underlying system dynamics, things like provider consolidation, the growth in specialty drug cost, increased utilization, and even the aging workforce. And for several years now, employers have realized that traditional cost shifting just isn't sustainable. And so we're seeing a lot of new approaches to plan design, to purchasing strategies, and really just to accountability across the healthcare ecosystem. So that's really where I would start in terms of, the current trends. But I do want to just layer in a second one, which is workforce expectations. We currently have like what, 6 generations in the workforce today, and they each have unique needs. And more importantly, they all have their own expectations. And so, from an employee perspective, they view benefits through their own lens of what's relevant to their lives. And that translates into their focus and perspectives on affordability and also on access, whether or not they can use the benefits. And so, employers are really in this situation where they have to be very responsive to those employees' expectations. And it's things around mental health, family support, flexibility, financial well being. Those are all hot topics today in this environment that we're in. And I think if I were to just try to tie it all together, I would sum it up by saying benefits decisions have really become business decisions because they affect talent, they affect financial performance and organizational resilience. And so, as a result, employers are really moving beyond just this idea of how do we optimize our benefits to really focus on a strategy that balances cost, compliance, the employee experience, just all of those factors that are at play in a much more complex environment.
Thank you for that. We could probably spend the next 3 hours talking about all the things you mentioned, but we're going to try to do our best to get to the key points and to leave people curious to do their own research and to continue the conversation here in the next 30 minutes or so. And as you mentioned, it is a driver not only for cost, which a lot of organizations look at, but it is a recruitment and retention tool. It is how people experience work, and it is not a matter of wanting or not. Sometimes people need it, and affordability, as you mentioned, not just on benefit side, but from cash compensation to how things are increasing in cost or fluctuating in cost through other cost of living measures. And so much to discuss there. And I know we don't have a crystal ball. I wish we did. And in an ever changing world that we live in, Tracy. But when you look at the next 5 years, what broad shifts, whether they be economic, demographic, or even policy driven, will most redefine the role that employer sponsored benefits play in the workplace?
Yeah. So, I'm going to go with door number two, demographics, because I think that that's an area that we all really need to be paying attention to. In addition to the six generations in the workplace place that I mentioned, I think that the topic of longevity is probably one of the biggest social and economic issues of our time. When you think about people living on average 10 years longer than our parents did and like 20 years longer than our grandparents did, um, you know, we that's a lot of pressure and a lot of opportunity for businesses. We've got, trend number one is that life expectancy has risen significantly. Trend number two is that birth rates are falling quickly. And the inequities in life expectancy are growing, whether it's because of lifestyle, affluence, gender, occupation, all of those things play in. And so I thought this was a really interesting factoid. The difference in life expectancy between the richest and poorest districts in Chicago, in the city of Chicago, is 30 years. And I think that, the call to action for businesses is that by 2035, there's going to be more adults age 65 and over than there will be children under the age of 18. And so these realities mean that we need to redesign for the times. Not only are people living longer, but they are physically and cognitively able to work longer. And that just puts a lot of pressure, but a lot of opportunity on businesses to support all these different life stages simultaneously and to be thinking about how they can support older workers to work longer because they're likely going to need them to continue to support their business. And so I think that, employers are just going to need to treat benefits more as long term investments in people and performance in order to support this change in demographics that we're going to be experiencing.
Thank you for that. And I think we're seeing it, and with the rising cost of healthcare and shifting, policy driven impact, that's really going to, we're going to see that in our own lives and the lives of our family members. But that's that you mentioned about more people being over the age of 65 versus younger. That impacts so many different things, and so a nice pivot or segue to talking about healthcare inflation. You mentioned it earlier. It's 9% year over year for at least this year, and expected to be the next year. Um, what are the underlying system dynamics driving these sustained cost increases? And perhaps you can talk us through sort of how you see things that might be more short term, or even if policy changes, costs that we can continue to expect, whether they stay the same or go up, or hopefully maybe go down even.
Yeah, it's really interesting when we talk about healthcare inflation, and I gave you the annual increase numbers, and it's very easy just to focus on those annual premium increases. But the reality is that these costs are being driven by several really deep structural dynamics that don't really reset from year to year. And so, whereas before, we might expect that healthcare inflation could kind of normalize or reset after a couple of, after a tough year or two, um, we can't really expect that anymore because we're faced with things like healthcare labor shortages and provider consolidation has had an impact on healthcare costs. I think I had mentioned the cost of specialty drugs, just the longer term impact of chronic disease. All of those mean that the costs are going to continue to outpace inflation, which is a really big challenge for employers and the health benefits that they sponsor. And so, what we see happening is that they're moving towards more active roles using new plan designs, considering alternative financing, focusing on data driven purchasing and direct contracting, all of the things that you would do to manage risk rather than to try to absorb it.
And as the benefits become more complex to design and administer, as we talked about, all these factors that are contributing to the increase in complexity, where are most organizations at risk, or where are they most at risk, rather, of the inefficiencies, overspending, and then really putting themselves in a difficult position to want to care for their employees now and in the future, but also wanting to maintain that their current spending and expected spending maintain the health of the business?
Yeah, I'm gonna kind of maybe pivot just a smidge because when you talk about the complexity in design and in administration, the first place my head goes is to AI. And I just want to share, we recently asked employers in our big survey of, like 2,000 companies, we asked them about their thoughts on AI, specifically to save money and to improve the employee experience. And I think that that is significant. And I would just say AI and technology. And, about half are planning to use that for benefit navigation and customer service. And I think that's significant in making benefits easier to navigate, easier to understand, because that really is going to be essential to having all of these strategies work well. But they're also relying on technology and AI for communications, for advanced analytics, even compliance support. And so, I'm optimistic about that to address those challenges that you mentioned. But the other thing too that I would mention is that when we look at our survey data, especially for the jumbo employers, because we think of them as like the leading indicator for where the rest of the market is going to go, their number one strategy for the next 3 to 5 years is measuring program performance to drive value. And I think that that's super interesting because depending on how you're managing your programs, there is the potential for inefficiencies and fragmentation because that's what happens with the strategies that we've had for the past several years, which is focused on point solutions and multiple vendors and programs and layering them on top of one another. And so, I think that what happens is that over time, those programs expand and they overlap, and you can end up paying, multiple times to solve the same problem. And so I think that, this is really more about evolution. Focusing on how do we evolve these strategies and make sure that they're focused on the right things. And, at the end of the day, I think we're going to end up in a place where we start to question some long-standing assumptions, things like what truly needs to be employer funded, what can be personalized versus standardized, and where do employers, plan sponsors need to play a direct role or versus being a facilitator or a navigator.
We'll be back in just a few moments. Stay with us.
Every HR leader knows the pressure behind a big decision. You're expected to move fast, manage risk, and choose the right strategy for your people and your business. That's why SHRM 26 matters. It brings together the insights you need to make smarter decisions on compliance, AI, talent strategy, leadership, and more. You get practical guidance that you can apply right away. But time is running out. This June 16th through June 19th, invest once and deliver value all year long. And as a loyal SHRM podcast listener, you get 15% off SHRM 26 registration when you use promo code podcast15. Register now at SHRM.org/SHRM26 and turn conference time into smarter decision making for your team.
You mentioned something about fragmentation and, figuring out different things for different people. And, the way that we're sort of seeing it from a macro lens here is, state, federal policy that may be different. Different states have different policies. Obviously, federal policy is evolving and changing. And an after effect of what we experienced collectively through COVID, or just a trend in the workplace, is remote work, is working from different locations. And we're seeing companies move offices or expand or contract based on things that they are deciding as a strategic lever in terms of state versus, or one state versus another. Um, from your perspective, the fragmentation that we're seeing across state and federal policy, is that a temporary phase, or is that something that leaders can expect to continue to go down that trend? And then how would you advise on sort of getting ahead of that so that they have their bases covered?
Yeah, that's a loaded question. Let me just start with at the federal level, because that's, I think, the trigger for a lot of what you described. And when there are unresolved questions at the federal level, like what we have now around affordability, coverage, prescription drugs, even so far as mental health and reproductive health, what happens is that the states will move faster and more assertively. And so, whether it's mandates or reporting requirements, paid leave, which has been a major pain point for multi state employers, privacy rules, I mean, all sorts of things, often reflecting, different priorities. It creates a patchwork system rather than, a single unified direction for employers to line up with. And so I want to comment specifically on ERISA preemption of state loss, which is a legal doctrine, as you know, that's been around for over half a century. We just had ERISA's 50th birthday party last year. But at its core, ERISA preemption allows states to regulate fully insured plans, but not self-funded plans, if the state laws relate to those plans. So what we're seeing is pretty strong attempt by the states to erode ERISA preemption via legislation and regulation, and that will likely continue. And the most important thing I want to say is that deserves employers' ongoing awareness. It's important. We need to maintain ERISA preemption. That is super helpful for employers that have people spread out all over the United States. The issue most recently has particularly raised high stakes related to the pharmacy benefit managers and prescription drug cost. And so that's one where employers do need to determine how these new state PBM laws affect self-funded ERISA plans. I don't know, hopefully the audience is aware there was a 2023 Mulready decision where the 10th Circuit struck down, excuse me, that's kind of a tongue twister, key parts of the Oklahoma law on ERISA preemption grounds. However, the Supreme Court upheld Rutledge versus the PCMA, the Pharmaceutical Care Management Association, that state laws merely regulating costs avoid ERISA preemption. So self-funded plans really do need to address any new laws that impact their PBMs with their legal counsel. But I would say for employers, this is not a temporary disruption. This is, the operating environment. And the challenge is to build strategies that can flex as these rules vary by geography. And, they're likely going to continue to change over time. And what I'll say, to kind of bring it all together is that it's a matter of kind of switching your mindset from compliance as a reactive exercise and really focus more on governance as a core capability within your framework. And so, it does require more work. I mean, it's a lot of work, just to keep up with everything, stronger monitoring, having decision frameworks that support compliance and benefit designs that can adapt without having to be reinvented every year. So, I mean, I guess, the punchline is that this complexity is probably here to stay. And the resilience really comes from designing for it rather than, hoping it goes away.
It's a complex thing, right? And there's, so many layers and, one thing can be true today as we record this and can be different tomorrow. Let's talk about the benefits from the person, using it or having access to it. And even, when we talk about organizations making these benefits available, even the folks that are in charge of the plans are obviously users of it from an employee perspective. And so this impacts everybody who's listening. As companies expand their offerings, what happens if it gets too complex or there's too many options? And as with all these things that we talk about, it is rather complex organizationally, but it is also complex for the individual and families to understand what is either available, who should use it, how do they use it, all these things. And so when they look at, first of all, sort of comparing the plans and then thinking about usage, limits, all these things, um, how is the complexity that we're talking about from an organizational perspective impacting the ability for the end user or the employees and their families to fully understand the benefits so that they can actually use it? And going to that point that we always talked about, which is to try to make this as affordable and as accessible as we can.
Yeah, I would say that the challenges of today are less about offering more benefits and more about making those benefits usable and understandable and affordable. And, I think the thing that we all need to remind ourselves of is that complexity does come at a cost. Anything that's very complex, you're going to see lower utilization of your high value programs or confusion at the point of care, or even just like frustration that will erode, trust in the programs. And it's really complicated in healthcare benefits where we're asking people to behave like informed consumers in a system that doesn't really support that. But I would say that organizations that are really making progress in this area are shifting more from a menu of options mindset to more of a guided experience and really simplifying plan designs where possible, and then using navigation and advocacy services to help people through the process. And the other thing, and I've been blogging a lot about affordability, I think that there's a direct link between affordability for the plan sponsor and affordability for the plan member. And by that, I mean, you really have to address affordability to change behavior. There's data that support that, 6 in 10 patients say that they've skipped or delayed medical care because of the cost. And so the things that employers are doing to address that are offering alternative medical plan designs that have lower copays with, incentives tied to using a higher quality provider. Things like enabling an easier way to pay for and afford your medical bills. Um, you know, Building employee confidence by helping them understand how to ask for and get help from their health plan. And so those are all things that can help people address that affordability issue and address the challenges that they have in understanding how to navigate. But I also think, we have to focus on enabling better access to care, and that will help drive impact. So, you know, um, giving access to low cost primary care, making it as easy as possible, and, um, you know, addressing how hard is it for people to get access to care, looking at your data for where care is provided, looking at, cost variations for the same services. Those are all things about affordability that, isn't just about what the company spends or what the employee pays in premiums, but it's really about whether people can access the right care at the right time without financial harm.
Manager effectiveness directly impacts performance, retention, and cost.
People are stressed, and they're stressed because of their people manager.
Traditional training builds awareness, but often fails to change behavior.
SHRM developed this thing called PMQ. That stands for People Manager Qualification.
PMQ. Teach managers how to manage, how to be more effective, more empathetic, more understanding, and better motivators of people.
Driving behavior change.
when it matters most.
Where the plus part comes in is Life Guides.
We unleash the power of every employee. If your manager was better and you were feeling mentally well and safe.
What Life Guides does is serve as that coach to connect with another human being who can help you navigate through all those real life examples that relate to you from the things that you learned in that training.
PMQ Plus is an addition to my toolbox. I've seen a better relationship with my managers and how they collaborate, how they work with each other. There's not that stress anymore because they feel like they have somebody to release.
That's why we created this PMQ Plus, Life Guides plus SHRM's PMQ.
Increase performance. Get PMQ Plus today.
SHRM.
We talked about this a little bit, but this entire conversation about benefits is a delicate balance between offering competitive benefits that care for the employees, the plan members, as you mentioned, but also managing costs responsibly, as the future always seems uncertain in one way, shape, or form. How is that balance, or striking that balance, becoming more challenging? And do you see a time when that might settle down a little bit into more of a predictable system that we can plan 3-5 years down the line?
Yeah, as I mentioned earlier, I mean, benefits decisions are truly business decisions. And for years, being competitive often meant just keeping pace with your peers on plan design and absorbing annual cost increases was just the price of doing business, just a lot of benchmarking. And what I think has changed is that healthcare costs are rising faster than wages and productivity. And at the same time, employees are expecting benefits to do more, to support mental health, flexibility, financial security, all of those things. And so instead of asking, how do we spend more or how do we spend less? I think the question to ask is, are we spending in the right places for the right outcomes? And so, it's really being more intentional about value, not just generosity. An example would be investing in benefits that improve access, like I mentioned, associated with affordability, or guiding people to high quality care. I'm the first to admit striking the balance is more challenging, but it's just so much more strategic. And I think that, benefits aren't just an expense that we're all trying to manage. They really should be viewed as a lever for workforce sustainability.
We talked about this before, which is the big trend. You picked door number two, which is, the demographic changes. I want to go into that a little bit more. And so, as we wrap the conversation here, Tracy, we know that what the trends are, right? We can look at, birth rate data. We can look at, retirement data. We can look at a whole bunch of things. And so, I want to focus on sort of the difficulty. We talked about the people staying in the workforce longer, and sort of the decrease of the population that might be younger or entering the workforce. But how do you advise leaders to strike that right balance when you talk about, you said 6 different generations? And again, we're generalizing and stereotyping here, but for the sake of this conversation, let's say that there are 6 different groups that need different things. We can't create 6 different plans, right? Also, there's some, age-related things that we can't do. But how do you plan and create a thing that is universally applicable across a workforce? And maybe this depends on, or that varies slightly based on what industry you're in, what type of company you are, size of company. Maybe we can generalize it by saying, what is the best way to, play to the middle, if you will, or to be, effectively comprehensive, but try to create programs and benefits that where everybody up and down the spectrum feels like there's something for them.
Yeah. It's a big challenge, that's for sure. And I think that if employers can embrace the fact that longer careers matter, that, people are working into their late 60s and 70s, and they are going to have different needs. But I think the good news is that, um, you know, you need to think more holistically about your programs, but it's all of the programs that you currently offer. So whether it's chronic condition management, caregiver support, financial wellness, and flexibility, those are all issues that are important to everybody in your workforce. It's just making sure that you really think about them from the perspective of life stages. And so for your older segment of your workforce that you'd like to perhaps keep engaged and keep healthy so that they're able to stay engaged, what are your programs doing to specifically address that? Caregiver has been a huge issue for the past several years for employers, but I think expanding how you think about caregiving support across all of those generations and what their challenges are and their life stage is really the key to making your current benefits work for everybody. And so, again, like I said before, not necessarily trying to add more programs, but making sure that your programs apply to everybody in your workforce and support them where they are.
As we mentioned at the top of this conversation, Tracy, we could probably talk about this not for 3 hours, but probably 3 days, as complex and as ever changing these topics are. But I think we did a pretty good job in about 30 minutes. And so I'll leave you with one question. And again, it's hard to choose one, but if there was one thing that you would ask leaders to do today, to think about, to talk about, to strategize, and to prioritize, that they can do today to design benefit strategies that can adapt, but also be helpful and be there for their plan members and their employees, what is the one thing that you would advise our leaders to think about today?
Yeah. So I'll just say mine's going to have a bit of a healthcare benefit focus since that's what I tend to do. But I would say if I had to pick one thing for leaders to do today, it would be to clearly define the outcomes that they would like to achieve for the benefits program and for the benefit of their business. And so, whether it's affordability, access, equity, workforce resilience, define what that is and then validate those priorities with data from your employees, whether it's focus groups, an employee survey, a conjoint analysis, and then build your program and a measurement strategy so that you can monitor and adjust as conditions change. But, practically, this kind of an exercise starts with better integration of your data across your health benefits, your retirement benefits, well-being, workforce analytics, and then, layer in some governance that will allow your leaders to monitor and make course corrections. I think that the organizations that will be the most resilient and the most productive and the most successful aren't the ones with the richest benefits or even with the most programs. They're going to be the ones that have flexible design, strong vendor accountability, and just that ability to adapt as policy, costs, and workforce needs evolve.
Excellent. Thank you so much. I've learned a lot. I have more questions than answers, Tracy, and I think our audience would agree, but that's a good thing. I think these difficult decisions and topics require conversation, require some thinking, and really, adaptability, as you just mentioned, in deciding what is best for both the organization and employees moving forward. Tracy, thank you so much for joining us. That wraps up this week's episode. You can find SHRM's latest workplace policy report and other resources we mentioned related to this episode in the show notes. Thank you so much for joining. See you next time on Tomorrowist. If you enjoyed today's conversation, please subscribe to Tomorrowist wherever you get your podcast. We also publish a weekly newsletter with in-depth articles and the latest SHRM research to help keep you in the know about the trends shaping the future of work. You can subscribe and find all of our episodes on our website at shrm.org/Tomorrowist. Thanks for listening. And remember, the workplace is changing rapidly. You don't have to be a futurist, be a tomorrowist.
SHRM.